The idea of the session was to show how community actions could actually lead to change in addressing all the unmet needs of people living with HIV today, especially today in which HIV is no longer a big priority for policymakers.
The efforts of the community have really been critical in making sure that patients have access to the newest treatments. This has been true historically, and it is true today. We need to make sure that HIV is understood as the priority that it has been and that it continues to be as a health priority here in Europe and across the globe. And the activities of the community are really key to making sure that policymakers understand the critical importance of HIV.
I think today we are failing on many fronts in response to HIV. First of all, we're not providing sufficient access to treatment in areas of the world in which are mostly affected by HIV. That's regions of the world where the number of new infections are still on the rise. We're talking about Eastern Europe and Central Asia. We're failing also about addressing inequalities in the access and quality of healthcare to underserved populations. Then we are failing still in the fact that we are not able to scale up PrEP in Europe. PrEP today is one of the most powerful tools we have, which can actually avoid new infections. HIV has become a chronic infection thanks to the highly effective treatments available today. So we must look at what our healthcare systems will be able to do. Are they ready today for this new challenge? What should they look like in the future? How should we shape them? These are all important things that we should be able to foresee today because they will strongly impact the health of our communities, and of course they will also impact the sustainability of our health systems.
The main barriers to care for key population, at least in Central and East European countries, are the lack of implementation of combined prevention programs. Also, there is still stigma and criminalization for key population, and there is also a lack of standards of care for HIV and co-infections in this part of the world.
Barcelona Checkpoint is a community center which was created in 2006. Community center is targeting men who have sex with men and transgender women, and our focus was to increase testing in this key population. We have been showing that with test and treat we are able to reduce HIV incidence with 60%. That's an important, but it's not enough. We need something more. Therefore, we need a new tool, which is pre-exposure prophylaxis, or PrEP. And therefore, people who are at high risk can be protected by using PrEP. In the 2-year experience, we have seen a reduction of HIV incidence by 76%.
It's really important for the industry and the community to work together to make sure that the medicines that the industry is working to create meet the needs of patients. Protocol review processes where the industry can work with the community to make sure that the issues that are most important to the community are included in the clinical trials is one area that's really important. And another area that is critical is for the community to work with the industry to make sure that ways are made so that the medicines that are created are available to patients.
The relationship between community and industry has always been, on one side, very enriching and also turbulent on other sides sometimes. EATG has been closely collaborating and working with industry since 1992. This collaboration has culminated in 1997 with the creation of ECAB, in which our meetings where we discuss with industry, which is in strict confidentiality, and which give us the opportunity of having first-hand information at a very early stage of drug development.
MSD has been involved in the HIV epidemic since the very early days, for over 30 years, working to develop new medicines, looking at how we can be involved in developing biomedical prevention. We continue to work to develop innovative treatments and prevention technologies that will help patients and those at risk for HIV be able to address their risk for HIV and their treatment needs over the course of a lifetime.